Imagine waking up on a perfectly ordinary Tuesday morning. You make your coffee, you sit in your usual chair. You feel not terrible, not great, just a little off. Maybe slightly more tired than usual. Maybe a faint tightness somewhere in your chest that you cannot quite locate. You think nothing of it. You assume it is stress or age or the fact that you have not been sleeping well lately. And so you move on with your day. You go to work, you come home. You do it again the next day and the day after that. Now here is what I need you to understand. What I need you to truly absorb before we go any further. In a significant number of cardiac cases, the body begins sending signals exactly like those. Not dramatic, not obviously alarming, but persistent, quiet, and consistent, up to 30 days before a major heart attack occurs. 30 days. That is a full month in which your body is essentially waving a flag and begging you to pay attention. And most people never see it, not because they are careless or unintelligent, but because no one ever told them what to look for. I am Dr. Robert M. Rose, and today I am going to change that for you. In my career as a cardiologist, I have treated thousands of patients across every age group, every background, every risk profile imaginable. And the conversation I have had more times than I can count, the one that haunts this profession, is the conversation that happens after the event. When someone looks at me from a hospital bed and says, "I felt something a few weeks ago, but I just assumed it was nothing." Today, I want to make sure that conversation never has to happen to you or to anyone you love. We are going to talk about the warning signs that appear up to 1 month before a heart attack. These are not textbook symptoms. These are the subtle, easy to dismiss, real-world signals that the body produces when the heart is beginning to struggle, when blood flow is becoming compromised, when arteries are under increasing stress, and when the cardiovascular system is quietly moving toward a breaking point. These signs are not guarantees of an impending heart attack, but they are warnings that deserve serious medical attention. And knowing them, truly knowing them, is one of the most important things you can do for your long-term health. The first sign that can appear weeks before a cardiac event is a profound and unusual exhaustion that bears no relationship to your activity level or your sleep. I want to be deliberate about how I describe this because fatigue is one of the most universal human complaints. And I am not talking about the ordinary tiredness that comes from a hard week or a poor night's sleep. I am talking about a fatigue that feels different from anything you have experienced before. A heaviness, an exhaustion that sits in your body rather than in your mind. A weariness that is present when you wake up in the morning and does not lift with rest. Patients who have gone on to have heart attacks frequently describe the preceding weeks as a period of unusual, inexplicable tiredness. One patient of mine, a 53-year-old man who had always been active and energetic, told me that in the 3 weeks before his cardiac event, he felt as though he was moving through water. Simple tasks that had never caused him any difficulty, walking his dog, climbing stairs, carrying groceries, suddenly required a level of effort that seemed completely disproportionate. He chalked it up to getting older. He pushed through it. 3 weeks later, he was in my operating room. This type of pre-cardiac fatigue occurs because the heart, when its blood supply is beginning to be compromised, forces the rest of the body to compensate. The muscles receive less oxygenated blood. The body is working harder than it should to maintain basic function, and the result is a systemic, pervasive tiredness that your body is using as a signal. If you or someone you love experiences a dramatic and unexplained shift in energy levels, Fatigue that is out of proportion to your life circumstances and that persists over days or weeks, that is your body asking you to see a doctor. The second warning sign is sleep disturbance and insomnia that arrives without a clear psychological cause. This one surprises many people. We tend to think of insomnia as a stress response, something that happens when the mind is overactive. And often that is exactly what it is. But there is a growing body of clinical evidence showing that cardiovascular distress can disrupt sleep in ways that precede an actual cardiac event. Patients report difficulty falling asleep, waking frequently throughout the night, or waking early in the morning with a vague but persistent sense of unease that they cannot explain. The connection is physiological. When the cardiovascular system is under stress, when the heart is not receiving adequate blood flow, when arterial inflammation is increasing, when the body's oxygen dynamics are being disrupted, the autonomic nervous system responds. It stays in the state of heightened alert. And that alertness interferes with the deep, restorative sleep cycles your body needs. So if you notice that your sleep has changed, if you are suddenly struggling to get the rest you normally get without any obvious explanation in your daily life, pay attention. It may not be anxiety. It may not be caffeine. It may be your cardiovascular system. The third warning sign is shortness of breath during activities that have never challenged you before. I want to distinguish this carefully from the breathlessness of someone who is simply out of shape or who has recently been sedentary. What I am describing is a change from your own baseline. If you are someone who has always been able to walk 3 blocks without any breathing difficulty, and suddenly you find yourself winded after half a block, that change is significant. If you climb a flight of stairs you have climbed 1,000 times and find yourself needing to stop and catch your breath at the top, that is not normal aging. That is a signal. What is happening in the body when this occurs is that the heart, under increasing strain, is becoming less efficient at pumping blood to the lungs and throughout the circulatory system. The lungs, receiving compromised blood flow, struggle to exchange oxygen and carbon dioxide at the rate the body requires. The result is a sensation of breathlessness that is completely out of proportion to the physical demand being placed on the body. In many patients, this symptom begins mildly and gradually worsens over several weeks, which is precisely why it is so easy to rationalize. I am just getting older. I have been less active lately. It is probably the heat. None of those explanations matter if the symptom represents a new and worsening departure from your normal. The fourth warning sign is one that I consider among the most under-recognized and clinically significant, and that is heart palpitations, irregular heartbeats, or a fluttering sensation in the chest that occurs without exertion. Now, occasional palpitations are extremely common and are usually completely benign, caused by caffeine, stress, dehydration, or disrupted sleep. But there is a specific pattern of palpitations that deserves serious attention, and that is palpitations that are new, that are occurring with increasing frequency, that are accompanied by any other symptom, or that happen during periods of rest when no obvious trigger is present. The heart, when its blood supply is being compromised, or when its electrical system is being affected by cardiovascular disease, can begin to produce arrhythmias, irregular rhythms, extra beats, or periods of racing that serve as an early warning of deeper dysfunction. Patients describe this variously as a fluttering in the chest, a pounding that seems too strong, a skipping sensation, or a sudden awareness of their own heartbeat that feels abnormal. Any of these presentations, particularly when they are new and recurring, warrant evaluation. An electrocardiogram, a Holter monitor, an echocardiogram, these are tools that can detect electrical and structural abnormalities weeks or even months before a major event occurs. Do not dismiss these sensations because they pass. Evaluate them because they keep returning. The fifth warning sign is upper body discomfort that seems to have no muscular or skeletal explanation. I am talking about discomfort in the jaw, the neck, the left or right shoulder, the upper back, or the arms that appears and disappears without any clear reason, that is not associated with any physical activity or injury, and that does not respond to rest or to the kind of treatments you would normally use for a muscle problem. People attribute this to sleeping in a bad position, to tension, to stress knots in the shoulder, to dental problems. And most of the time, they are right. But sometimes they are wrong, and the consequences of being wrong are severe. This referred discomfort happens because the nerve pathways that carry pain signals from the heart to the brain are shared with nerve pathways that serve other areas of the upper body. When the heart is struggling, the pain signal travels up through these shared pathways, and the brain sometimes interprets it as coming from the arm, the jaw, or the back, rather than from the heart itself. This is the same mechanism responsible for classic heart attack symptoms. But in the weeks before an event, the signals are often far more subtle. A recurring ache rather than acute pain, a persistent stiffness in the jaw, a strange heaviness in the left arm that comes and goes. If you are experiencing any unexplained discomfort in these areas that keeps returning, a cardiac evaluation is not an overreaction. It is sound medical judgment. The sixth warning sign that can appear in the weeks before a cardiac event is gastrointestinal disturbance, specifically nausea, indigestion, stomach pain, or a general feeling of abdominal discomfort that is unusual for you. This is perhaps the most frequently misinterpreted warning sign in the entire spectrum of precardiac symptoms. People take antacids, they change their diet, they assume they have a stomach bug or acid reflux, and the actual cause, cardiovascular compromise, goes completely unaddressed. The lower portion of the heart sits in close anatomical proximity to the diaphragm and the upper gastrointestinal structures. When the heart is under stress, the vagus nerve, which serves both the heart and the digestive system, can transmit signals that are experienced as stomach upset, nausea, or a persistent feeling of indigestion that does not respond to the usual remedies. This symptom is particularly common in women, which contributes to the significant disparity in how quickly and how aggressively heart attacks are diagnosed and treated in female patients. Women experiencing a cardiac event are far more likely to present with nausea, fatigue, and jaw pain than with classic chest pressure. And those symptoms are far more likely to be dismissed both by the patient herself and sometimes by the medical system. I cannot state this emphatically enough. If you are a woman and you are experiencing persistent, unusual gastrointestinal discomfort alongside any other symptom on this list, please seek cardiac evaluation without delay. The seventh warning sign is something I call anxiety without a source. Patients describe it as a general sense of dread, an inexplicable feeling that something is wrong, a persistent unease that they cannot attribute to anything specific happening in their lives. It can feel like generalized anxiety, or it can feel more physical, a subtle but constant tension in the body, a feeling of being on edge that does not go away. From a clinical standpoint, this makes complete physiological sense. When the cardiovascular system is compromised and the body is under internal stress, the sympathetic nervous system activates. Stress hormones are elevated. The body moves into a subtle but persistent state of alarm. And the psychological experience of that alarm is anxiety, a sense that something is wrong, even when the rational mind cannot identify a cause. Many of my patients who experience this symptom in the weeks before their cardiac event later told me that they had mentioned it to friends or family and been told they were stressed or overthinking or going through a phase. A few had even mentioned it to physicians who had attributed it to life circumstances rather than investigating it further. I am not suggesting that every person who feels anxious has a heart condition. What I am saying is that new, unexplained anxiety, particularly when it appears alongside physical symptoms, deserves to be taken seriously as a potential cardiac signal rather than dismissed as purely psychological. Now I want to speak directly and honestly about something that I see create hesitation in patients every single day, and that is the fear of overreacting. There is a deeply embedded cultural reluctance, particularly in the United States, and particularly among men, to seek medical help for symptoms that feel vague or nonspecific. There is a voice in many people's heads that says, "You are being dramatic. It is probably nothing. You do not want to waste the doctor's time." I want to address that voice directly and tell it with the full weight of my medical experience that it is wrong. The cost of underreacting to cardiac symptoms is measured in heart muscle. Every minute that passes during a cardiac event in which the heart is not receiving blood, approximately 2 million cardiac muscle cells die. Those cells do not regenerate. The damage done to the heart during a cardiac event that could have been caught earlier or prevented entirely is permanent, and it is irreversible. So when you are weighing the embarrassment of a false alarm against the consequences of being right, understand what you are actually weighing. A few hours in an emergency department that turns out to be unnecessary costs you an afternoon. Missing the warning your body was sending you can cost you decades. If you are watching this video and you recognize yourself in any of these signs, unusual fatigue, sleep disturbance, new shortness of breath, recurring palpitations, unexplained upper body discomfort, persistent gastrointestinal upset, or anxiety without a clear source, especially if these symptoms have appeared together or have been worsening over the past several weeks, I want you to make an appointment with your physician today. Not tomorrow, today. Tell them specifically that you are concerned about your heart and that you want a cardiac evaluation. Ask for an ECG. Ask for blood work, including cardiac biomarkers. Ask for a stress test if appropriate. Advocate for yourself. Be specific. Be persistent. And if any of these symptoms are severe, if you are experiencing chest pressure, radiating pain, sudden extreme shortness of breath, or if you feel that something is genuinely wrong right now, do not drive yourself to a clinic. Call emergency services immediately. Time is heart muscle. Every second matters. I also want to speak to those of you who are watching this not for yourselves, but for someone you love. An aging parent who keeps dismissing their fatigue as just getting old. A spouse who has been complaining of indigestion for 3 weeks but refuses to see a doctor. A sibling who mentioned they have been having trouble sleeping and seems more anxious than usual. You now have information that they may not have. Share this video with them. Have the conversation. Be the person who speaks up. In my experience, the patients who are caught early, the patients whose cardiac events are prevented entirely, almost always have someone in their life who pushed them to get evaluated when they were ready to dismiss their own symptoms. The heart is an extraordinary organ. It beats an average of 100,000 times per day, every day, without pause, without rest, from the first weeks of life until the very last breath. It asks for almost nothing in return. But when it is struggling, when blood flow is being restricted, when its muscle is under stress, when the months and years of lifestyle choices and genetic pressures are beginning to accumulate into something dangerous, it does speak. It speaks in the language of these symptoms. It speaks quietly, persistently, over days and weeks. And it speaks precisely because it is giving you a chance. I am Dr. Robert M. Rose. What I want you to take from this video is not fear. Fear is not useful, and it is not what I intend. What I want you to take is knowledge. The knowledge that heart attacks rarely come without warning. The knowledge that your body communicates with you and that those communications are worth listening to. The knowledge that a month of quiet signals, recognized and acted upon, can be the difference between a life interrupted and a life lost. Know these signs, trust your body, act early, and please share this video with every person in your life who has a heart, because that, in the end, is every single person you know. Thank you for being here. Your heart matters, and so does your life.